Well, we're definitely kicking off an interesting week for Healthcare Week. Few industries have experienced the rate of change that healthcare has undergone since the COVID pandemic, from the rise of telehealth to mRNA vaccines, increased competition from big box retailers, and now, of course, the weight loss drug boom. Much has changed since 2020, but is the way we look at our healthcare really that different? Joining me for more and a look at that, our first guest for Yahoo Finance's Healthcare Week, Sachin Jain, CEO of Scan Health and Health Group. Thank you so much for joining me today.
Honored to be here. Happy Diwali.
Happy Diwali to you too. So let's talk about that. Is it really different? We know that so much has changed since the pandemic. We were forced to find healthcare outside of hospitals when they were locked up with patients. We saw the rise of pharmacy and retail health, as well as telehealth, really play a role. I know you're in charge of a payer, but you do have some thoughts about this. So tell me about what you think has changed permanently in the way we view healthcare.
Well, for one thing, I think we no longer think of facilities as being at the center of people's healthcare experience. But I do think one thing that people are starting to think about is really the soul of healthcare. And what I mean by that is, I think these large institutions that people typically relied on for care were local, and people felt like they had a real relationship with them. Today, people are increasingly seeing care, accessing care through virtual means, as well as through other channels. And I think people are wondering, where is that relationship going to come from? And I think it's a big challenge for the industry, which is that many people expect a strong relationship. And some of what the digital health and telehealth revolution has done has switched healthcare into a series of transactions as opposed to a relationship-oriented field.
I'm glad you said that. Transactions is the key, because we know there's also the rise of cash pay options and the like. And all of this while the traditional system is a little bit under pressure. We know that, for example, hospital systems, other facilities and industries, sectors in the industry are looking at making ends meet. You had an interesting thought recently on layoffs, saying specifically a specific savings target becomes a blind fixation that overtakes even a passing analysis of the staffing levels to meet even basic service levels. And to translate that into normal terms, layman terms here, it's basically that there are so many endpoints that these facilities have to meet, whether it is revenue or staffing levels, and it comes at the detriment of care.
Look, most physicians I talk to believe that we have a crisis in the management of healthcare organizations. And that crisis really comes from the application of MBA toolkits to healthcare delivery settings. And what I mean by that is, when you're trained as an MBA or a finance person, you are really trained to think about things in terms of targets and hitting those targets. And sometimes there are things that are more important than targets, like patients, like people, like the workforce, like staff morale, that have a critical effect on the output, which is the clinical care that's actually delivered. And I think sometimes the excessive focus on targets leads us away from actually delivering the kinds of outcomes and building the kinds of relationships that we were talking about before. And so you do see health systems that are laying off people, not necessarily thinking about whether or not they have adequate staffing to actually serve the patients that they're serving in order to meet their financial targets. Now, many people say things like no margin, no mission. At the same time, there is just meeting the basics of actually taking care of the people that you're taking care of and being in the business that you're in. And so if you're not able to necessarily restructure your organizations or restructure your care processes to lower costs, and your only blunt instrument is a layoff, you end up in this funny situation where people in some of the best academic health centers in the world or the best health systems in the world are saying that they don't necessarily have what they need to actually take care of patients. You have labor strife, you've got strikes, you've got increasing regulatory and reimbursement pressure. This is a very tough time to be in healthcare. At the same time, the thing we can't lose sight of is our focus on patients and focus on doing what's right for the people that we're trying to serve.
And on that note, you have put your money where your mouth is a little bit in that respect with your efforts with homeless care, as well as creating a formulary for patients to access care, drugs at a lower cost. So talk to me about setting all that up. These efforts that you're doing, is it something that can be replicated at scale, or is it only population specific to where you are?
Look, the homeless efforts that we launched really came from acknowledging the fact that we have an epidemic in plain sight. You go to many major metropolitan areas in this country, and you see that, besides incredible riches, we have people who are struggling with mental illness, struggling with addiction, living on the streets. And what has been cast in many settings as a housing issue is really a healthcare issue. And so we as SCAN Group have made an investment in a new medical group called Healthcare in Action that is part of the SCAN Group that ultimately serves people on the streets, that ultimately tries to address the needs of patients who otherwise wouldn't have access to care and services. And we measure ourselves one way. It's whether people get housed or not. And we're pleased that more than 100 people have actually been housed through our Healthcare in Action program that started just a couple of years ago. The other thing that you referenced was our new formulary, which is associated with our Medicare Advantage plans. And what we are doing is offering some very common drugs, the drugs that we would want for our mom and dad, at zero copay. These are branded drugs, and this is in line with some of the regulatory changes associated with the IRA that have been introduced, wherein these drugs are going to be available to people for lower costs, and the government is negotiating them. We're introducing a zero copay or $11 copay formulary 2 years in advance of the IRA negotiations, because we wanted patients to actually get access to these drugs. You asked whether it's replicable. I think it is replicable. I think we have to move away from gimmicky healthcare to actually delivering healthcare and serving people the way that they need. Whether you're a for-profit or not-for-profit, we happen to be a not-for-profit. At the end of the day, we have to try to serve people the way that we want them to be served. And we, I think, have gotten away from that in our industry.
Yeah, it seems like it's a lot easier to negotiate drug prices these days. Should we just be doing it ourselves?
Very easy. You and I should just go and negotiate. Yeah, so let's call Eli Lilly today.
Let's do it. Well, thank you to Sachin Jain, CEO of SCAN Group and SCAN Health Plan. Thank you for joining us today.
Great to be with you.